Hello friends, I am Dr. Pritesh Junagade, a hematologist and oncologist practicing in Mumbai and Nasik. I have done my MD medicine from Mumbai at Sion Hospital. I was in UK for 7 years training in hematology and oncology. Today I'll tell you something about not a very rare disease called aplastic anemia. Getting this disease is not good, but due to the new advances in what we have today, this disease can be treated. So what is aplastic anemia? Aplastic anemia is a term given to a disease where your hemoglobin, white cells and platelets, all the three main components in your blood are low. When they are low and they are not formed or synthesized well in your factory, which is called the bone marrow, we get aplastic anemia. So in short, it is bone marrow failure. People get renal failure, kidney failure, heart failure. Similarly, bone marrow failure, where the factory fails to produce enough cells, it is called aplastic anemia. It can occur at any age, commonly seen in children, in Indian subcontinent and Eastern Asia. It is quite common in these countries. So how do you detect, how do you diagnose aplastic anemia? How do people come to know they have aplastic anemia? Obviously, the patient comes commonly with three problems. Number one, when the hemoglobin goes low, they become weak, they have fatigue, they don't feel like doing anything, they look pale, and that's how they realize that the hemoglobin is low. Number two, when your white count or white blood cells are low in your blood, these are the cells which are important in your immunity or immune system. They help you fight against infections. So when the white cells are low, you get infections easily. So a person getting repeated infections, say for last a month or two, with no obvious reason, the white cells could be low, and this could be one of the signs or symptoms of aplastic anemia. Number three, the platelets, the third cell which is there in our body or blood. If that is low, you get easy bruising. People get bruises all over their body. They do have gum bleeding, nose bleeding, or in serious cases internal bleeding. And that's how they can present to a doctor. Many patients have one of these problems. Some patients have all three problems. So this is how you are going to present, or a patient with aplastic anemia is going to present to his or a doctor. So how do you diagnose, how do you confirm aplastic anemia? We do routine tests like complete blood count, where we know what is the level of your hemoglobin, white cells and platelets. Then we go on to do a special test called bone marrow test. The bone marrow test is done through your backbone, which is the pelvic bone, and after we read that bone marrow, we come to know the bone marrow is empty, and that's how we call a patient of aplastic anemia. So after you have diagnosed, it is important to find the cause. Patients do ask us, doctor, why me? Why do I have an aplastic anemia? How did I get it? Well, in many patients we do not know the exact cause, but there are certain things, certain causes which you are very aware of. The commonest is quite a few patients have been exposed to certain chemicals like benzene. People who work in dye factories, polish factories or paint factories can get aplastic anemia. But you need to be exposed to these chemicals for a prolonged time or a long time, then you are prone to get aplastic anemia. There are certain drugs which were used in the past, especially chloramphenicol, which was an antibiotic. It has been taken off the market recently. That used to cause aplastic anemia. Number three, there are many infections, some viral infections which can cause transient or temporary bone marrow failure. Certain infections can lead to prolonged bone marrow failure and aplastic anemia. Few of the patients who get aplastic anemia have had jaundice in the past, and they have had liver infections with certain viruses. That can also lead to aplastic anemia. Previously, some of the patients have had blood cancers or say other cancers and they have received chemotherapy or radiotherapy. A late effect can be seen when a patient develops aplastic anemia. So, a diagnosis becomes easy if we find a cause. Still, the treatment remains the same. So, what is the treatment for aplastic anemia? What your doctors or hematologists are going to tell you how to treat aplastic anemia? Well, the best treatment for aplastic anemia today is a bone marrow transplant or stem cell transplant. We will discuss about stem cell transplant in my next talk, but we just need to remember that for a bone marrow transplant we need a donor, and a donor especially in India has to be a brother or a sister. Your parents will not be suitable as a donor, or your cousin brothers, cousin sisters, your friends will not be suitable as a stem cell or a bone marrow donor. This is because there are certain genetic things we need to note when you do a stem cell transplant, and only a brother or a sister, if you have one, would be a match. In countries, in European countries, America, there are registries of bone marrow where they are donor registered for bone marrow donation. And in these countries, we do get an unrelated donor. So the best thing for aplastic anemia is to do a bone marrow transplant. Well, if you can't do it, or if your finances don't allow you to do it, the next best option is an injection called anti-thymocyte globulin, which is called ATG. This is a special injection produced from horses or rabbit, and we give it over 5 days or 4 days in some patients. The patient has to be admitted for 5 to 10 days. We give the injections and then start a special capsule after this injection is completed for 6 to 9 months. Around 60 to 70% of patients will respond to this therapy, which is called ATG therapy. In India, especially in our Lotus Institute of Hematology and Oncology in Nasik, the total cost of this therapy is around 2.5 to 3 lakhs. The next best option, if you can't afford this injection, is a capsule called cyclosporine. We give it for 6 to 9 months. Again, 30-35% of patients do respond to this therapy. The next best option, if you can't afford above 3, is a tablet called Minabor or Danazol. We can give it for 6 to 9 months again. Some of the patients do respond. There are some new drugs which is called L-Thrombopag. L-Thrombopag is a new drug which has come recently, which has shown promising results in aplastic anemia. Time will tell us with this whether this new drug stands the test of time. Now, giving these drugs, giving this medication is not easy because of the finances involved, but if you can afford, you should really strongly go for this treatment early in the course of a disease. During this course, whatever treatment you take, you need blood product support. Meaning, when your hemoglobin is low, you need blood from a donor, which is called a simple blood transfusion. If you bleed a lot, you will need platelet transfusions from a blood bank. Well, you don't get white cells from a blood bank, so you can't treat the low white count. And that is the problem. And that causes more infections in such patients. Patients might come to me with repeated infections. We might have to give them IV antibiotics, meaning intravenous antibiotics. Just oral antibiotics, which we take for routine cough and cold, are not sufficient in this disease in many patients. We need to take care generally when we want to prevent infections. When your white count are low, your diet has to be clean, meaning you should eat warm, cooked food. You don't want to eat street food or undercooked food or uncooked food like salads. Please avoid those foods. Then your hygiene has to be good. You should brush your teeth at least twice a day. You can use aseptic mouthwashes like chlorhexidine mouthwash. You should keep your intestine healthy by not eating any other unhealthy foods. If you think you have got burning in your urine, you need to see a doctor quickly to control the infection there. And if you have children in your house, who have got flu-like symptoms, please keep away from them. In such cases, you can use a mask to prevent yourself from getting infections from other patients or other people. You should avoid crowded areas like a packed cinema hall or a disco. It is not a good place to go when you have got aplastic anemia. Again, swimming is not really advisable when you have aplastic anemia because the chances of infections when you go to a public pool are much more. Well, if you can afford a private pool, that's a different story. Aplastic anemia, my friends, is a treatable disease today. If you diagnose it quickly, if you have the best treatment available and you can do it immediately after the diagnosis, you have got a good outcome. So please don't be depressed when you hear a diagnosis of aplastic anemia. We've had number of cases where people are living normal life. A patient of mine recently delivered a normal baby, having diagnosed of aplastic anemia 2.5 years ago. So there are positive things to take. Just make sure you listen to your doctors regularly, take their advice, and possibly take the treatment as soon as possible. Obviously, there would be many doubts in your mind still. You might have many questions, but we'll try that answer later on. And for that, you can visit our website www.lotushematology, that is LOTUSHEMATOLOGY.com for further information. Thanks for your help. Bye bye.